polymyalgia rheumatica is an inflammatory muscle disorder. It's not an arthritis because it happens in the tissues between the joints, so in the muscles and in the tendons and around the ligaments. It's usually above the elbows, so in the top of the arm and the shoulders, around the back of the neck, and above the knees, going up the thighs towards the hips and round the back. It feels very much like you've taken extended muscular exercise when you've got polymyalgia, and you've got unfair stiffness and pain that's worse in the mornings and when you've been sitting down for quite a long time. It tends to be an age-related condition. You never see it under the age of 50, and with increasing age, it becomes increasingly frequent. Most people that we see with polymyalgia are over the age of 70. It's more common in women than men, and it's estimated that around about 1,200 people in the UK every year develop the condition. Often it's not recognized as polymyalgia rheumatica and just put down to the stiffness in joints and muscles that comes with age. However, it comes on very quickly and you don't get old very quickly. So it can be recognized if you take a careful history. Quite sure what the main causes of polymyalgia rheumatica are, but it seems as though people are genetically susceptible to develop polymyalgia rheumatica. So you can see it in different members of a family across the generations. Sometimes, strangely enough, you can see it in people living together, so unrelated man and wife. So it's a genetic susceptibility coming together with a trigger that starts the process off. And sometimes that trigger is very obvious, like a big road traffic accident, trauma, a big shock to the system like a bereavement. Sometimes it's subtler and comes on after infections. And in fact, I've seen it happen a few times over the last year or two following COVID infection, and in fact, also following COVID vaccination. So it seems that if you get given the wrong trigger in the wrong person, you can then develop polymyalgia. And the development is all about pain and stiffness. And it can sometimes come on overnight. You can go to bed feeling perfectly well, get up in the morning, hardly able to move your arms and hardly able to get up out of the bed or out of the chair. Sometimes it comes on much slower than that and starts either in the shoulders or in the hips and gradually spreads across shoulders and hips until you're giving an impersonation of a very old person when you're actually not that old altogether. Often if you ask somebody with polymyalgia to get out of a chair, they can't get out of a chair without hauling themselves up by their arms and has to rock to and fro. People with polymyalgia often can't get into a bath and have started having showers, can't get comfortably in and out of their cars. And when they've been sitting for a long time, perhaps having a cup of tea or a talk, it's very difficult for them to get out of the chair. And some people get very upset with this because not only is it awkward for them to lead their lives, but they can feel very gloomy and depressed because the inflammation that accompanies polymyalgia rheumatica can make you feel really quite unwell, flu-like and off color. People with polymyalgia can even lose weight and have low-grade fevers, so it can masquerade as either an infection or even worse as an underlying cancer. So sometimes it gives a very different view and initiates a number of investigations. Polymyalgia is a self-resolving condition in the vast majority of cases. In other words, it gets better by itself. So usually the time is a very extended time course and can go on for at least 12 months, if not closer to 18, 24 months, or even up to 3 years. Nothing dreadful will happen if it's left untreated and is purely polymyalgia rheumatica, but you can get very deconditioned. Your muscle power and strength can be affected, a bit like if you've stopped exercising altogether for a couple of years. You can feel really out of sorts, and you can have things like your work affected if you're still working and have polymyalgia. So it can have a big impact on life, but it doesn't leave any permanent difficulty. So it's not a damaging arthritis like rheumatoid arthritis. It's not a thing that will lead to fracture like osteoporosis. So what we like to do is we like to give the self-resolution of these conditions in hand and treat it so that the symptoms will get better very quickly. And whilst the person who's suffering from polymyalgia has to wait the time until the condition goes, if we treat the condition correctly, we can get them to be pretty much asymptomatic. There is one slight problem, and that's that polymyalgia rheumatica can be associated with a condition called temporal arteritis, which is a condition that causes headache, tenderness across the temples, and discomfort around the jaw, and can be associated with inflammation in the blood vessels. And if that is accompanying polymyalgia, then it becomes much more of an urgent condition to treat, because otherwise the arteries in the scalp and around the head and neck can get damaged and can sometimes even clot off to produce difficulties with vision. So that becomes much more of an emergency than plain polymyalgia itself. Diagnosed primarily on the history. So it's important to take a good history about pain and stiffness. Ask whether or not that pain and stiffness is worse in the mornings, because typically inflammatory conditions are worse at the start of the day, the last few hours of nighttime, and the first hour or two in the morning. So that gives you a clue that it's inflammation, because if it's simply the wear and tear of old age, that tends to be better in the mornings and worse in the evenings. So early morning exacerbation gives you a clue. You also need to make sure in the history that you do ask about headaches and this stiffness and pain across the jaw, just to make sure you're not dealing with polymyalgia and temporal arteritis. Some people believe that you can only diagnose polymyalgia if your blood tests are abnormal. In particular, two tests for inflammation, one called the ESR, or erythrocyte sedimentation rate, and the other called the CRP, or C-related proteins. So both of them can be elevated very mildly, quite high, and in some cases not at all. So a lot of the patients I see referred to hospital with a possible polymyalgia are referred in because the GP is not convinced that the patient has polymyalgia, because they have no abnormalities in the blood tests. So the acid test for seeing whether someone has polymyalgia, if you've taken the history, if you've done the blood tests, is then to say, actually, you can firmly diagnose them as having polymyalgia if you treat them with a dose of steroids for a couple of weeks and all of the pains and aches go away. That doesn't mean you can stop the treatment there, but it means that your diagnostic test is more than 80% better over 2 weeks with a dose of steroids of 15 milligrams every day. If you have polymyalgia rheumatica, there's nothing you need to avoid doing. But if you have untreated polymyalgia rheumatica, there are certain things that you might not be able to do. So things like gardening, like driving for long periods of time, like walking the dog, like doing all sorts of things you would do normally. So it really is important to recognize and treat, because it makes life an awful lot better. There's not really any dietary association that can either harm or help polymyalgia, and there's not really very much else in your everyday life that you should avoid. So stresses don't make polymyalgia worse, although they can trigger it in the first place. So you really need to lead as normal a life as possible. And my advice is make sure you get it recognized and treated at an early stage. Starting with the home remedies, there really aren't very many home remedies that can be helpful. Sometimes the diagnosis of polymyalgia can be delayed by taking shop-bought ibuprofen, which can, as an anti-inflammatory, help just a little bit, keep people almost functional enough but not comfortable so they don't seek help. So there's nothing wrong with taking ibuprofen, but it can mask the diagnosis. But none of the other home remedies like turmeric or rosehip or chondroitin that can sometimes help osteoarthritis. None of them really help polymyalgia because the inflammation in polymyalgia is just too intense. It's much more of a disease than a condition. So it really comes down to the fact that there is only one effective treatment for polymyalgia, and that's steroids. So some people's hearts sink when they think they might have to take steroids, but if steroids are managed carefully and the steroid doses adhere to the recognized and recommended guidelines, you can get your polymyalgia treated very effectively, really without too much in the way of side effects. So steroids it is, and usually in polymyalgia, steroids are given by mouth, and usually you take 3 little 5 milligram tablets a day for the first 2 weeks to see whether you've got polymyalgia. And if you do, you then tend to do monthly reductions. So you take 15 milligrams for a month, 12.5 milligrams for a month, 10 milligrams for a month, and then go down by 1 milligram every month for the next 10 months. So it's pretty much a year's treatment. There are 1 or 2 precautions you need to take with steroids. If you've got a very sensitive tummy, then you sometimes take a tablet to stop the steroids upsetting the tummy. So something like an antacid or a PPI, which is a drug to stop the tummy getting inflamed. But in most people, they tolerate steroids very well, and you absolutely don't need to give those drugs as a routine. But what you do need to do is to recognize that because people will be on a substantial dose of steroid for a longer period of time than 3 months, they need to recognize they must preserve their bones, their bone density, because steroids can thin bones, both in men and in women. So what we tend to do is to give something to protect the bones alongside the steroids, and usually we'll use a tablet that's taken once a week called alendronic acid. Or if you can't take that tablet, there are various injections you can take that are 6 monthly to protect the bones. And you use that protection all the way through your steroid treatment until you come off the steroid and the polymyalgia's gone away.